Hi everyone, I'm Zach Breeding. I'm the clinical dietitian of Drexel University College of Medicine's Adult Cystic Fibrosis Center. And so we're doing these videos in order to provide education to all patients with cystic fibrosis with different themes. So today's theme is going to be on cystic fibrosis-related diabetes. So CF-related diabetes, or CFRD, is a special kind of diabetes. It's kind of like type 1, kind of like type 2. I like to call it diabetes 1.5. Basically, for various reasons, CF has inhibited the pancreas from functioning, and so this causes diabetes. It's not quite type 1 because you're not necessarily born with that dysfunction, although it could happen, and it's also not type 2 because it's not always damage that's being done from an external source, like food. So we're going to make a recipe today that's going to be perfect for someone with cystic fibrosis diabetes. It's a breakfast quinoa dish. So it has banana, maple syrup, and quinoa, which is a really great whole grain. Whole grains are awesome because they contain fiber. Two things help delay the amount of sugar that goes into the blood. Those two things are fiber and protein. Well, quinoa has both. So what those two things do is they delay how fast the sugar goes into your blood. The blood sugar has less of a spike. This creates the insulin to react to the sugar a lot easier, and so your hemoglobin A1C, which is a test that determines how well your blood sugar is for the past 3 months, that level is more in the normal range, and the finger stick test that can be done for testing blood sugar is also a lot better as well. So everyone's happier, you feel better, your blood sugar is normal, and everyone's happy. The first thing to do with this dish is start with a quinoa that's been rinsed under cold water. The reason why you rinse it is just to get any sort of stuff that's on the outside off. So I'm going to dump that into a microwave-safe bowl. This is a microwave recipe, so it's really easy to make for the morning time, for breakfast, or when you're really just tired and you've done your treatments and you're just sick of being in the kitchen and eating or having to worry about cooking. So this is a great recipe for that kind of stuff. So you take your quinoa, dump in your water, and then we're going to dump in about half a teaspoon to a teaspoon of cinnamon. If you like things really cinnamony, you can add more. It's no big deal to me. And then a teaspoon or two of butter. So most people with CF, not all, need a high protein, high calorie diet, and well, butter has good calories and it's good fat. So we're going to throw that in there as well. Give a little bit of a stir. My butter was already softened, but you don't have to do that. You can just throw it in. It doesn't matter. And you're going to nuke it on high for about 4 minutes. All right, so this is going for about 4 minutes. While we have the time to talk a little bit more about how CF-related diabetes can happen, one of the reasons is because of an insulin insufficiency, which means the insulin can't get into the bloodstream in order to grab the sugar and bring it into the cells. Obviously, this can be because of scarring to the pancreas, because of the nature of cystic fibrosis, or because there's actually less cells that produce insulin, or because of chronic inflammation caused by cystic fibrosis to the pancreas, which results in less ability to function. This actually happens in about 40 to 50% of my adult patients, but it can also happen in about 20% of adolescents. As CF becomes more of an adult condition, you start seeing a bunch of other comorbidity type diseases happen in the adult population, which is why talking about this kind of stuff is very important if you're a pediatric patient that's transitioning into adult care, or you're already an adult patient and either you don't have CFRD, but you might be concerned that it's coming on, or you just want to learn, or you already have it and you might not know how to manage it that well for whatever reason. So there's a few ways that you can diagnose CF-related diabetes. The main one, the gold standard one, is by the 2-hour glucose tolerance test. So basically you take some form of sugar, it could be a drink, it could be a tab, something like that, that raises your blood sugar like crazy. And then your blood sugar is tested at 1, 2, and sometimes 3-hour intervals. Based on that result, we can kind of see how your insulin response works to that sugar, and that would diagnose cystic fibrosis-related diabetes. So the normal results for a 2-hour would be less than 140. An intermediate, like a pre-diabetic state for CFRD at a 2-hour would be over 140, and CF-related diabetes would be characterized by anything over 200. So we see that more often than I would like to probably admit, just because it's the nature of the disease, but treating it is fine. So nutritionally, most people with CF are on a high protein, high calorie diet, And so we're not cutting down carbs because carbs are a great source of calories. They're delicious and they're relatively easy to prepare. And with the burden of treatment that can exist in CF, and because cooking isn't always possible with fatigue, or you're just not maybe into cooking, which is totally cool, carbs are really easy to cook. And so we don't want to cut them out completely, but we should balance them out throughout the day. So traditionally, people like to have carbs with carb. Think spaghetti and meat sauce with garlic bread. That's carbs with carb with a little bit of meat and tomato sauce. So basically, that's not the best idea, because with impaired insulin, that doesn't really have much ability to access that sugar from the carbs and bring it into the bloodstream. So a great example of what you should do is probably bring in some sort of fat, some sort of protein to delay how fast the sugar goes into the blood. Use whole grain pasta, because that has the fiber, to bring the sugar into the bloodstream a little bit slower as well. And then add some fruits or vegetables to make you fuller. Again, not to cut down carbs, but rearrange it throughout the day so you're eating more consistent carbs all day long, as opposed to a really carb-heavy meal, say at dinner, and for breakfast you may be eating eggs and sausage, which really has no carbs at all and mostly protein and fat. So incorporating toast or biscuits or pancakes or waffles in the morning, cutting down some carbs at night, adding a carb at breakfast, maybe having some carb-like snacks is all a great way to look at CFRD. The second step is talking to your dietitian, like me. Carbohydrate counting is a way that we educate on what I just told you about. So your dietitian will know how many carbohydrates you need based on how many calories you need based on a variety of things that we worry about. I call it dietitian math. So your dietitian does dietitian math, figures out how many carbs you need in a day, and then based on that will give you good instruction on how to rearrange your meal plan for any given day. Even with this nutritional treatment, you still might need to go on insulin, and that's okay. It's just one more tool in your toolbox of care that you're giving to yourself that helps you better treat your blood sugars. Insulin is not always fun to give. It involves testing your blood sugars on your finger, which can be a little bit painful. It might involve injecting something into your stomach or your rear or in your thigh to put insulin into your body. This might not always be fun, but it's a necessary evil, especially when you have CF-related diabetes. And really, most of you guys are doing tons of treatments and medications anyway, that a little needle probably isn't going to affect most of you, but it is just one more thing. The insulin is dosed depending on how many carbs you eat, so working with an endocrinologist or a certified diabetic educator or a CDE can help you figure out how much insulin you need per carbs and how that would be arranged throughout the day. This is all optimized when you're counting your carbohydrates. When you're looking at how many carbs you're eating in a given day, it's important to look at using the right amount of insulin. So with carb counting and insulin, and hopefully some physical activity in there as well, which helps pulmonary status as well as nutritional status, we're looking at a great hemoglobin A1C, we're looking at great blood sugars. It's just optimal nutrition status overall. So this has gone in for 4 minutes. I've stirred it. It goes back in for 3 minutes. And then now it should be ready to go. You pull it out. You cover it with aluminum foil for about a minute so it steams the rest of the way. That holds for about a minute, and then you go ahead and take it off. You add some milk. This is about 1 tablespoon or 2 of milk, whatever consistency you like. And then bananas, good form of vitamins and minerals, especially the fat-soluble vitamin K. Cut it up however you like. I like to cut it up just like this in the peel. Easy, no cutting board, no mess, no banana in your hands, I don't know. And then you can go ahead and dump that in. Give it a bit of a stir. If it's still too thick for you, if you like your oatmeal a little bit thinner, you can add more milk, you can add more maple syrup. I'm gonna add a little more maple syrup to it. We're gonna add about maybe a tablespoon. Okay. Give that a little stir. And you're good to go. That's an easy, quick breakfast idea. Enough carbs are in here, fiber, protein, and fruit. So that's the recipe. That's CF-related diabetes. If you have any questions at all, just respond to this video or talk to your dietitian at your CF Care Center. I hope this information helps.